Okay, now we are looking at Reye syndrome. So this is whenever there's rapid liver and brain dysfunction after a viral illness, like flu or chickenpox. This usually happens in kids below the age of 15. So risk factors. Aspirin. Do not use aspirin in children. This is one of the main things, aspirin, in kids with viral infections. Do not give children aspirin. And the use of salicylates, however the hell you say that word. Aspirin is one of those. So that's why you don't want to give them aspirin. So salicylates and aspirin, those are your main two. Your main two things that she's definitely going to ask. Signs and symptoms. Vomiting, lethargy, confusion, seizures. And if they're in a coma, that is a very late sign, but it is a sign. Treatment and management of it. Avoid aspirin or salicylates in children. You want to monitor for increased intracranial pressure. So to control it, you want to elevate the head. This just means they have a lot of pressure in their head. So if you elevate that head, the pressure and blood flow can go down. Supportive care in the ICU. So you want seizure precautions. You can also give vitamin K for liver dysfunction. And you want to look for salicylates and over-the-counter medications. So the one that she listed was Pepto-Bismol. So you don't want to give them Pepto-Bismol. The other one that was in the book was Alka-Seltzer. So you don't want to give Pepto-Bismol, you don't want to give Alka-Seltzer, you don't want to give aspirin. All of those have salicylates. She's definitely going to ask a question about Pepto-Bismol or Alka-Seltzer. So focus on that as well. And you want to monitor eyes and nose. So that's going to be your main thing. So that's over Reye syndrome. Now we're going to look at head injury and head trauma. So head injury and head trauma. Trauma causes brain injury, and it can be from mild to severe. So risk factors for head injury or head traumas are going to be falls, sport injuries, car accidents, or just accidents in general, child abuse. If they have a bigger head, usually in children's heads are bigger than their body, so it causes them to be unbalanced and they can fall. Or a high activity level. The more active you are, the more you're running around, the more chance that you have to fall. And increase curiosity in children. They're very curious. They are always testing limits, and because of that, you can fall, you can have an accident. So signs and symptoms of a head injury or head trauma is going to be headache, vomiting, altered level of consciousness, seizures, and visual changes. So treatment and management. You want to assess the ABCs: airway, breathing, circulation, level of consciousness, and the pupil response. So the child's spine must stay stabilized. If they have a head injury or head trauma, you want to make sure that their spine is stable. So whenever you're looking at the pupil responses, if it's fixed and dilated, or if it's fixed and constricted, or if it's sluggish, you need intervention. So if there's clear fluid leakage, this is cerebrospinal fluid, and you want to notify the primary care provider. You also want to monitor for increased intracranial pressure. And for children with permanent brain damage, you want to encourage rehab or rehabilitation center. And you want to encourage the use of helmets and seat belts to parents to prevent head injury and head trauma. However, if there is no loss of consciousness, this is mild. So you want to stay with the child for the first 24 hours, and you want to wake them up every 2 to 4 hours to ensure activity while they're sleeping. So if they don't have loss of consciousness, you can do these things. If they do have a loss of consciousness, or they lose their level of consciousness, then you want to make sure that you go to the ER immediately.